This is Eye on the Community, and I'm your host, Sean Anthony. Joining us up next is the CEO of PrimaryOne Health, Ms. Charleta Tavares, here to talk about the Healthcare Justice Awards. Ms. Tavares, welcome back to Eye on the Community. How are you?
I'm doing great, Sean. It's great to be back with you.
Absolutely. Tell our audience, before we dive into all the other information about PrimaryOne Health. Explain it to our listeners.
Well, PrimaryOne Health is a comprehensive primary care healthcare center. We have been in business since 1997 as originally Columbus Neighborhood Health Center, Inc., now PrimaryOne Health. We have 12 locations throughout Franklin and Pickaway counties and 2 mobile health centers. We provide all of the primary care services, including pediatrics, women's health, OBGYN services, internal medicine, as well as dental, vision, physical therapy, behavioral health, and then a lot of specialty services and services that we call enabling services like transportation, translation and interpretation, and other services to meet the needs of our patients.
Excellent. Now, what is this Healthcare Justice Awards? What's going on with that?
Well, this is our 7th annual Healthcare Justice Awards event. I started this back in 2015 as a way to identify those people in our community who are lifting up cultural competence, lifting up the underserved communities, marginalized communities, and addressing their needs. Also, those individuals who have stepped forward and identified ways to ensure that marginalized communities, underserved communities are getting the services that they need. It's a fundraising event, and we are now establishing a new fund with this year's Healthcare Justice Awards celebration to create a scholarship fund. And the scholarship fund is for racial, ethnic, and cultural underserved or underrepresented communities to apply for, either to go into healthcare professions or to advance their career in the healthcare professions. And the reason we're doing this, Sean, is because research has shown that we get better health outcomes when we have culturally competent individuals coming from those same communities of the patients that they serve. And PrimaryOne Health has a large percentage of our patients that are racial, ethnic, and cultural underserved communities in Franklin and Pickaway counties: African, African-American, Latino, Hispanic, Asian, certainly a small percentage of Native Americans, large Bhutanese, Nepali population, and 35% of our population of patients speak a language other than English as their primary language. So a very diverse organization, and we believe it's incumbent upon us to have a diverse staff to meet their needs.
That's awesome. I got to applaud you for that, Ms. Tavares, because I just did an interview last week with a council member, and we were talking about just the disparity of diversity in the healthcare profession, which is why so many of us are apprehensive, of getting some of those services provided. So that's awesome. This event, the Healthcare Justice Awards, when is it?
It's on November the 4th. It is from 11:30 until 1 p.m. It's on a Thursday afternoon, and it's at the University Marriott Hotel off, I think it's 3100 Olentangy River Rd. It was renovated hotel off of Olentangy River Rd. But Sean, this year we're doing a blended event. We're allowing folks to decide whether they want to come into the hotel and see the program live and eat their lunch there at the hotel, or for those who may not feel as comfortable, that they can indicate that when they register that they would rather pick up their lunch. They can drive by, pick up their lunch, and then watch the show live, either on their phone, their tablet, or their laptop back at the office.
Is this invite only, or is this open to
It's
the public?
open to the public. And as I said, It's tax deductible. That portion of their ticket that doesn't pay for the food, because if you get something for your money, that's not tax deductible. So the portion for the food is not tax deductible, but the rest of the donation is going to the scholarship fund so that we can encourage more racial, ethnic, and underserved cultural populations to go into healthcare. And so all of those dollars will go towards scholarships. And we hope to build an endowment so that we can continue to give multiple scholarships to individuals going into the professions.
Excellent. That's awesome. Tell us about this new, a little bit more of this scholarship, PrimaryOne Health, that you guys create. I know you just touched on it briefly just now, but let's dive a little deeper into that.
Well, what we've seen, and particularly at PrimaryOne Health, it is very challenging to find a social worker, a psychologist, a psychiatrist that comes out of our racial, ethnic, and cultural communities. We have very few African-American social workers, psychologists, and psychiatrists. I was just joking with Dr. Sarah McIntosh, who was just recently hired as the medical director at Alvis. She had served at Maryhaven, and I told her, I said, I was trying to steal you for PrimaryOne Health because we just don't have enough people of color going into these professions. In many cases, they get encouraged to move to another profession, particularly if they're going into the entry-level professions. As they go in, then they're being snapped up and moved into another career. So we wanted to make sure we were doing our part. Instead of asking others to do it, we've created this scholarship fund. We're going to pour money into that so that we can give scholarships to individuals and help them fund their education so that they can serve our community.
That's awesome. So who are some of this year's recipients?
We don't have the recipients identified for the scholarships yet, but what we do have is our Healthcare Justice Award recipients that we just recently named. Councilwoman Priscilla Tyson is the Community Healthcare Justice Award recipient. And then Tina Vamos, who is one of our staff members. She is a site manager at both our 1905 Parsons Avenue location, as well as our, I believe it is 3781 South High Street location. She's the site manager for both of those locations.
Excellent. I just interviewed Council Member Tyson a couple of weeks ago. Why did you choose her?
As I shared, we really wanted to lift up those individuals who have been championing healthcare for the underserved. And not only has Councilmember Tyson for 7 years been the chair of the Health and Human Services Committee of Columbus City Council, but she has really started the efforts in Columbus and Franklin County on addressing food insecurity with the food plan that she and the county commissioners developed together to look at how we can develop community gardens in underserved areas that don't have fresh fruits and vegetables, don't have grocery stores. She also championed the discussion, the analysis, and the planning with the Commission on Black Girls. She really wanted to focus in on the challenges and the opportunities to serve African-American girls in Columbus. And that is really something that hasn't been done before. And it really is a way to lift up our young girls who are facing many challenges. And so that is getting to cultural competence, that's getting to addressing the underserved, and it's also getting to identifying unique needs of racial and ethnic populations. So we believe that she's not only been a champion for health care and ensuring that we have health care in our community, but also tackling other issues around cultural, racial, ethnic, and cultural communities, and then addressing some of the social determinants of health, be it the food plan and food insecurity, jobs and business development, or education.
Awesome. Sounds well deserved, of course. I'd like to switch gears now. This seasons have changed. This variant is going around with COVID-19. Share a little bit about how PrimaryOne is helping to fight against COVID-19.
Absolutely. Well, we have been working with our colleagues in the community, our other healthcare organizations in the community, the state of Ohio, the city of Columbus, the county of Franklin, to address the pandemic from the very beginning. We have served over 13,000 residents with vaccines. We have also provided testing to over 34,000 residents in Franklin and Pickaway counties. We've recently launched our mobile health center units that can go to the people. We partner with organizations, faith-based organizations, churches, synagogues, mosques, as well as community-based organizations and housing complexes for older adults or for families within the community, so that they don't have to come to us, we can go to them. So we take the mobile health unit and partner with those community-based organizations. What we've seen is that early on, there was a lot of anxiousness and people were more excited about getting, because they were scared about getting the vaccine. That's kind of waned. And as you can see from statistics, the state of Ohio is not doing great with respect to getting full vaccine immunity amongst our residents. We're still right below 50% for full vaccination of our residents. That's concerning. And so we're continuing to identify other groups that we can partner with so that we can get more of our residents vaccinated.
From your side of the spectrum, being in the healthcare industry, what are some of the biggest misconceptions that you may hear about the vaccine?
Well, one is that people believe that it came to market too quickly and that it didn't go through the same trials and research and study as other vaccines or other medications. The other misconception is that, well, many times people don't want to get it because they don't know what's in the vaccine. Most of us don't know what's in the medications that we may take or the shots that we may take, whether it's for the flu, the influenza virus, or for any other virus or vaccination that a person may get. So that's it. And then many people, particularly communities of color, still have some hesitancy based on unethical research and testing that was done on African Americans and people of color in the not too distant past.
And what have you seen that works in educating people about the vaccine?
I think first and foremost, developing a strong relationship with their own healthcare provider and listening to questioning their healthcare practitioner on what they believe is the best course of action. Having that relationship with that practitioner helps them to understand the vaccine, why it's important for them, and then to answer any of their questions. The other is to make sure that we are directing our patients and our residents of Columbus and Franklin County and Pickaway County and throughout the state of Ohio to accurate government information, accurate information from scientists, not from Facebook and Instagram and Twitter, from people who are making up their own evaluations of the vaccine, people that are not scientists. It's not the CDC, it is not the FDA that basically researches and evaluates and determines whether a medication, a vaccine is appropriate for X, Y, and Z condition. And so giving information that's accurate, that's consistent, and that they can go to as a source that's credible, that's important as well.
Now, lastly, this Delta variant, has this had an impact on the vaccines?
It has. The Delta variant is 50% more communicable or more contagious than the regular COVID-19, the coronavirus. It has really taken a lot of people into the hospital that wouldn't have been in the hospital had they not contracted the variant, the Delta variant. It has, I think many of our residents are more scared with the Delta variant. Those that haven't had the vaccine as of yet, I think they're practicing a little more social distancing, even if they haven't received the vaccine as of yet. There have been more breakthrough cases of COVID with the Delta variant, those individuals who already had the vaccine and they are then getting COVID, but they haven't ended up in the hospital. And that's the piece that everyone should remember, that if you're vaccinated, even if you contract some symptoms of COVID with the Delta variant, you won't end up in the hospital and you won't be intubated. You stand a much higher percentage of being okay, maybe having some symptoms, but not being deathly ill.
Wow. Any closing remarks before we conclude?
Well, what I would say to everyone is everyone has to look out for their health. It's healthy to ask questions, particularly from a trusted source. This is the best way to protect yourself with the vaccine, but it's also a way to protect your loved ones. That's why I got the shot, because I wanted to make sure that I protected my 95-year-old uncle who I wanted to go to his birthday party. And so I got the vaccine. I love my family, I love my friends, and I certainly love and respect the people that I work with. And so I wanted to be safe to be around them. And that's the best we can do if we really care about our friends, our family, and each other.
Well, it was always a pleasure. The Chief Executive Officer for PrimaryOne Health, Ms. Charleta Tavares, you take care. Good to talk to you.
You do the same, Sean. Thank you.
All right, bye now.